have today in social media really is a misconception. It's not what social was intended to do. So that's my speech today, and I'm going to try to give you examples and ROI supported examples to help you go back and change the way you approach social. Any questions about that? It's kind of an odd thing to say, but I hope I'll be able to support it. So real quick, three concepts. Consumers are regaining control of their brands. A lot of people think that brands are in the possession of the company, and a company can just make a brand. But I don't think that. I'm relatively alone in that thought. But I think a brand is really just the sum parts of all their customers' viewpoints about the brand. And it's constantly changing. Okay, so that's sort of a rule for the new social 2.0 economy. Companies that listen will get everything they need to be successful. So I started listening to our customers, talking about WellPoint, having horrible problems that were left unhelped. If you listen, you'll get access to data that nobody has. You'll get the latest trends, and the best part about listening is there's no researcher-induced error, which is a complicated term, but if you hand out a form or you have, God forbid, a focus group, your presence there influences the response. You get responses like, I really like being on the phone for 45 minutes on the customer center. Or these are like how things like New Coke came along through a focus group, and we all know how that worked out. So listening is huge, and it's getting more and more sophisticated every day. It gives you great live data that you can use to drive your business. And then the last one is really the toughie. It's how do you scale to this massive conversation, massive one-on-one conversation with not only your customers, but people who may be leaning on being towards you. They might become your customers in the future. I call them constituents, or just people that are interested in healthcare in general. There's no reason why if you employ a lot of your employees, you train them in social, you make that investment, that you can't start this massive conversation. So you see where I'm going here. Most social today is really advertising rammed through the social channel. Well, we set up a Facebook page, and then we had to do something with it, so we put banner ads from the 90s on this Facebook page, and then we're shocked when it doesn't work, okay? So these are the three real guiding concepts. So we heard a lot about number one today, customers really owning their brands. And I think that's a pattern of thought that's starting to sink, okay? So some inconvenient truths that may or may not make sense of what you're doing today in your media. So responsiveness beats planning. That's heresy, right? Because we have big companies that make really long plans, and that meant a lot before. It doesn't mean much today. A great example would be Oreo. So if anybody watched the Super Bowl last year, there was a power outage. And immediately Oreo Cookie put out a tweet with a picture that said, you can dunk in the dark. It's okay to dunk in the dark. And they owned social for that period of time, right? They didn't have a plan, but they were responsive. And that's what we need to be in healthcare, especially because there's this constant trends moving through healthcare all the time, like the miracle food, guacamole, right? Who's jumping on that? If you're planning horizons a couple months out, you can't take advantage of that. The other thing that's working against the planning methodology is that youth think very differently. Think about Pandora, that's temporary. Think about Uber, that's not owning a car, that's temporary. Everything is moving towards the temporary. There's a lady named Mary Meeker who is totally a genius, and she calls it the asset-light generation. They are shedding all of their assets. And part of that is about just living in the moment and being responsible. So what's more asset-heavy than a health plan? Okay? Responsiveness is huge, and it really flies in the face of the way most classical marketers and business people are trained. Communities beat audiences. The big difference here is that audiences are paid for. That's Mary Tyler Moore thought, right? We can put a show on TV and a few million people will watch it. We have an audience that we paid for. But a community is far more powerful. Think about an online community that your plan would set up. If once you get people in there, it's self-perpetuating as long as you manage it. It's much more powerful because it continues to deliver value long after the audience flew the coop. Reputation beats branding, okay? This is a real hard one to get over. But your reputation online is built through your goodwill and how effective you are at dealing with customers online. Branding is still important, but still looks back to a world where you could purchase people's opinion, okay? So, I'll try to give you an example. Think about products that you know from the past that couldn't exist today. And the one that comes to mind for me is Toughskins. I think a lot of you lived through the Toughskins generation, right? Toughskins is a Levi's product. It was a Cold War military secret that they had invented a fabric that was wearproof, okay? You could fall off your bicycle at 90 miles an hour, get 10 stitches in your knee, and wear the same pair of pants to school the next day. And you always knew the kids that unfortunately got Toughskins. On the first day, they walked like this. And that was me. Today, they still sell Toughskins, but they're not like they were in the 70s. That brand, I would submit, could not possibly exist today because it would get torn to pieces on social. The same is true of the Pet Rock, the Jarts, beer before Sam Adams. You know, things were bad, and brands took advantage of that, okay? Like they can't do today. Today, when you're a band and you put your guitar on United Airlines and they break it because they're a bunch of morons, you write a song about it, it gets 4 million views, which is more than most cable TV shows get ever. United has to change their baggage handling methodology because of that one band. That couldn't have happened 10 years ago, okay? So reputation is super important. Think about your health plan and how it runs. Is the reputation that good? Could a very famous person take you down? Because it's almost happened to us with the comedian Sarah Silverman. She almost took us down. If we weren't watching online, she really could have done a lot of damage to us. Loyalty beats PR. We kind of covered a lot of this already, but I have examples at the end of this where, because we care, because we monitor, listen, and interact with people on social, they actually will defend us. Oh my God, defend a health plan? Are you kidding me? It's happened, and I have proof. But loyalty then becomes super valuable because your PR department's it's like a spotlight in the night. You know, it's only going to be able to 10, 20 people, right? Why not have all your customers looking out for you all the time? And that's possible. Okay? So if you have any questions, I'm kind of blazing through this. So how do you get there? And this is really where I want to spend most of the time. I want to give you folks actual things you can do that make sense, that have worked for me, and you can justify. So let's just break it down into a hierarchy, right? So we started with listening, then you got to move to engaging. You know, what do you do with that data that you've been listening to? And then the top of the pyramid is owning. And this is something that Facebook and Twitter, if you're customers of theirs, they don't want you to own because they want to keep you. They want to keep giving you lousy data because they don't give you much data when you're a customer, no matter how much money you spend. But you owning your own social network is by far more valuable. So it kind of looks like this. We went through listening. The cool part about listening is you can track people who are interested in health, see who they follow, what they talk about, what the trend is that day, because it's responsiveness. There's no month trends. It's like a day and a week now, and it's probably going to go shorter soon. What they like, what they retweet, this is really valuable data. We're in a renaissance right now of social data. People are just hemorrhaging their life stories out for you to examine and learn from. They also say when they want to buy stuff, which is wonderful. Keywords, the warning here is keywords and sentiment. Keywords are dangerous because they're artifacts of the past. Okay? When you say healthcare reform, that's what happened a couple days ago. Through machine learning, you can get a tool that will look at a vertical, say the health vertical, and then tell you what the trends are happening in that vertical without a keyword. So if you're out buying listening technology, you hear the word keyword, run, because that's going to handicap you. Sentiment also is the same. Sentiment is very sophisticated. It's really only a rule of thumb. You have to be super careful about putting too much stock in what the sentiment value, say like 50% of everybody talking online favors your company. It's not that accurate. So moving up the food chain, you want to get to engagement. So what are you going to do with that? And what we decided to do was that so many folks were complaining about getting bad information from their doctor, their friends, all up and down the line. We decided to do customer service because that's the way we were going to engage. And the beauty of customer service and social is that it's a lot cheaper than the phone. And it matches what people want. And it's not 20-something kids living in their parents' basement. The average social customer service customer we have is right in our sweet spot. Female, 35 to 40. And that's how they want to interact with us because they can multitask when they do it, unlike the phone. So you have to think, everybody's different. Every plan is going to be different. But how you engage is really up to you. And listening is the path to help show you where your best efforts are going to be placed in engaging. Okay? And then the top is owning. When you own your own place in the world, not Facebook, not Twitter, say your brand social network, and you nurture it, you can learn things that you would never know through Facebook or Twitter. And that really is the way I think of the future, because Facebook is dead with people under 25 now. They're not joining. They're doing things like Snapchat, Poke, and then it gets even more fragmented from there. So owning your own delivery system is really important. And nurse case management communities are popular in this area because you've got the efficiencies of social versus telephone, and you can collect data on people, who they talk to, letting them talk to each other, what time of day, what device they log in on. You can pass what they say through analytics to determine what the important trends were. It's, in some instances, a lot better than the phone. And one of the interesting quirks is that when you let members who have a disease talk to each other, they get better faster than ones who are in isolation. Nobody can explain it. Doesn't matter. It's simply a fact. And it's been researched over and over again. One of the things you're going to run into when you try to do this is how do you coordinate all these parts of your business that are interacting and engaging. We did it with SharePoint to begin with. No cost option, had some limitations. There are much more sophisticated things out there like Salesforce's Social Hub, which we use now. It's a really good tool, but you don't have to get sophisticated. I try not to use email if you can avoid it, but SharePoint did us right for a while. So what's all this mean? Where are you headed? Okay? If you listen, if you engage, if you pay attention and you care, you might someday get in the position where someone tweets out there, hey guys, do you have health insurance that you're happy with? Who's your provider? I may be switching. And then she even names us Anthem. She didn't mention us, so we couldn't have found her if we weren't looking. But we're converting people like this into customers through the new channel of social sales. And you can't do that unless you play, unless you listen. That, to me, really is the ultimate goal. Because if we're not selling new customers, what good is it? And around sign-up time, messages like this are coming over the yard arm every second. It's very popular. Millions of conversations per day. So that's the loose hierarchy of how it works. Just a note on, I want to try to answer some questions if I can, but there's this whole concept which I'll distill this slide into one quick comment. The old days, the Mary Tyler Moore days, you had just a few hundred people making content for the rest of the world. Think about it. In LA, there was somebody writing scripts for the Mary Tyler Moore show or the Dick Van Dyke show. They influenced millions of people. They didn't have cats riding vacuum cleaners getting 50 million hits online. So now the difference between what's professional media and what's amateur media is closing. And at the same time, you've got the Wall Street Journal, New York Times, and the network TV going right down the tubes. So it's important to think differently about your creative and content. And what I'm trying to say in this slide is that creative matters a lot less than the content you provide. Think of it this way. You have to keep up with all the cats on vacuum cleaners. So spending a lot of time doing very in-depth creatives is going to slow you down, and you're not going to be able to keep up. And also the thought that your PR and marketing departments are the only ones that are going to communicate with the general public, they can't keep up with this massive cloud of conversations going on. So real quickly, great storytelling is a part. Every one of us in this room has successes with our business. It's about exposing them to your members or the general public, and then linking your media together. Mobile, traditional media, social, so that they all build more than they were worth alone. Relationships. This is about turning the company inside out. So you've got people in departments that never spoke to customers before doing so on social media. And my next slide covers that. You want to build relationships. You want to introduce members to each other, introduce your staff to your members, maybe even your members to your vendors. Who knows? There's any number of combinations. But the sum of all those relationships is going to be a lot bigger than traditional media was before, or social media 1.0. And you get there, we have a program at WellPoint called Brand Ambassadors, where we train thousands of members, or thousands of employees, to engage with our membership. And we don't give them access to social tools until they've been through this training. And it's been pretty good. So think about it this way. They're not all on message like a PR professional would be, but they're on our side. It's a big deal when you've got that many people pulling for you. So a quick note on sales funnel and what we've discovered along the way. The old world was sales funnel. Well, sales was responsible for sales. And people logically move through this progression of identification, exposure to marketing, sale, cash comes out the other end. That's dead. What we're experiencing today is that we get a lot of sales through our service area. I would venture to guess that nobody ever called a healthcare customer service line looking to buy something. But for some reason, on Twitter, they will do that. And they do that. And we also get HR. HR is sort of involved in the social mix too. They're getting sales leads as well. They're getting new product development ideas. It's not a pipeline, it's total chaos, but it does produce sales leads. So this is what it looks like when you map it out, okay? It's a big, messy network, and this is what we've built. So going around the horn, these are the departments that we have involved in social at WellPoint. Advertising, sales, service, new product development, HR, fraud, PR, consumer marketing. Someday, we'd like to get the clinical data meshed up with that. And over here is staff collaboration, which is a dream of mine. So that when we're collaborating on new products and ideas, we're bouncing it off the general public. So at the center are customers and constituents. And again, I'm mentioning constituents because in social, the economic rules are turned on their ear. In advertising, you buy one unit, you get one unit. In social, if you set up a social presence, the difference in servicing 10 customers to 100,000 is measured in pennies. It's not like advertising or traditional media. So you can focus on more people than you did before. And that's wrapped by listening. So let's look at some of the pathways that come here. So this is what's emerged in 5.5 years of doing this. So service delivers sales leads to sales. because we have this network established of sharing these leads. That never happened before. Advertising also delivers leads to sales because we have a Facebook presence that's pretty interactive, and we answer people's questions when they ask. Okay? So this starts to get more and more complicated, right? Service is giving you product development ideas, right? This is called collaboration, by another word. Service is sending HR recruits to HR, and HR is sending sales leads out because they're all collaborating on this system that we call social CRM. It has nothing to do with sales, right? It's just added business that we get because we're active on social and we're interactive. Okay? So that's the network as it sits. If I fully drew it out, it would look like a hairball, and that would be a good thing, but it wouldn't help you very much. So then, and I'll take some questions hopefully after, if you've mastered this, really, social 2.0, a conversation. This is a map of a conversation that has business value. And getting back to that, service on social is pretty inexpensive. Fraud, because there's tons of fraud that's exposed on the social web, is very helpful to the organization because we can identify people either who are most typically victims of fraud or perpetrating fraud. It's not uncommon for us to intercept a message where someone says, I keep ordering ID cards and someone steals them out of my mailbox. So we will send that lead over to fraud and they'll follow it up. So that's the network. And the last slide I'd like to leave you with, if we have enough time, is this is the icing on the cake. For all of history, businesses have managed scarcity, right? The most complaintive customer, the sickest person in healthcare. With social, because it turns economic ideas on their ear, you can start doing something a lot more fun and a lot more valuable, which is managing abundance. You can start focusing on healthy general public, new members, like Rocco said, unhealthy, undiagnosed, and people struggling towards wellness. So here you have the very few, fractions of a percent, and because social works differently, you can go all the way over here to people that aren't even your customers yet, and you can deliver them value through communities. And you can do that because it's so much cheaper to interact with people online than it is a one-on-one medium like the phone or a mass media like advertising. So out of this, the values that you would get by hosting this huge conversation with people you normally wouldn't have interacted with are incredible insights into how people view their health plan, their health, people around them and how they influence their health. Okay? They're generating content that you wouldn't have had to generate, right? It might not always be exactly right the way your legal staff would have put it, but it's free content that is evergreen, continues to deliver value, and product innovation ideas that come because now you've got a real decent sized chunk of population that exceeds any effort you could have done through a focus group or paying for this type of research. You're getting it yourself. So that's my presentation on Social 2.0. Are there any questions? I don't know how long I have. 5 minutes of questions. Yes, sir.
Tim, when do you think that sentiment analysis is going to be a little bit more actionable? I mean, it's a good tool, but it's still a little dull. Kind of mentioned that.
Yeah.
How far do we have to go before it's
a long way? So it's basically what you're doing is you develop rules in a vacuum, and then you pump a lot of social interaction through those rules that aren't customized to your particular company, and you make this back-of-the-napkin analysis. You can do a lot better if you write your own rules, which is not something many health plans have on staff, a talent. But if you write your own rules, you can do pretty well. So at Columbia, I use sentiment analysis to diagnose diabetics through their social commentary, and we're pretty accurate at doing that, but that's a custom rule. So it's a long way, unfortunately. That's nice.
I'm interested in the process that you guys have gone through in talking about this abundance. One of the elements of that around service is that you're going to be hearing complaints that from people who might not want to pick up the phone and call you.
Yes.
So how are you managing to get service to actually connect with them without overwhelming, getting more people on the phone, I guess is my concern.
You're going to get more people on the phone.
Okay.
Yeah, so that's the inconvenient truth. It's the second time I've done this. If you set up a new contact medium with a lower friction, more people are going to come. And it's better to just tell your management that right off the bat. So that will happen, but then if you are smart about how you do intake in social, like there are certain problems we won't address in social, ever. Like people that are, they've been denied services, they think, right, and they're very upset. That's not something you really can do well on social. So we bump them right into a call queue. If it's something that is a little bit easier to handle, and we've handled some pretty complicated stuff, like formulary stuff has been handled, online, we'll keep them, because, and it's hard to get my Gen X head around it, right? But there's some people that just don't want to call you.